Good morning, everyone. I am Dr. Valenzuela. I am a bariatric surgeon. I live in Tijuana, Mexico, and I was working with Mr. Ron, Mexico Bariatric Center for 9 to 10 years already. So you can know we have a lot of experience doing bariatric procedures with very good results in our patients. So we are improving right now through all these years doing the procedure. We are improving in less incisions in the laparoscopic gastric sleeve. So I actually do 3 incisions for this procedure. This is more or less new. I have been doing this for 2 years, the last 2 years, doing just 3 incisions in the most of the patients possible. So why I say the most of the patients possible, because this is depends of the patient too. If the patient did a very good pre-op diet and they have a small liver, and by other side, if the patients don't have a hiatal hernia, a big hiatal hernia, we can do these 3 incisions. So at the end, this is less pain and fast recovery. In movement, the patients can't get a fast recovery and better because they will not have a big pain. They can breathe deep and easy after surgery and walk and do everything. Some patients says, I don't feel nothing. This is any pain in my recovery, so they are very happy. So this is very, very good for us and for the patient because the recovery is so good and so fast. And we have a very, very good results with this technique is with just 3 incisions. You could see in the imagine, we have the camera in the right side and 2 hands, just 2 hands to perform the surgery. And there's almost no pain in this kind of procedure. So you can be the fortunately patients to get this kind of procedure if you do a very good pre-op diet, because we need to have this small liver to perform this kind of surgery. But the most of the patients who can perform the pre-op diet enough, they can have this opportunity. Okay, so we can continue with the presentation with like Mr. Ron says, we have a different kind of techniques. The popular technique in the world right now is the gastric sleeve surgery. This is a very good tool. This is a very good surgery. We know have a very good results. This is many years approved under the world consensus in the main Congress, and if so is the International Federation of Obesity Congress, and is the gold standard to go for all surgeons and do consents and the world consents. So we are approving this surgery for many years to give to the patients this tool and this opportunity to lose weight and long term, and with the low risk possible. So this surgery, it's consists in remove the 82% of the stomach. We perform a tube, a calibrate tube with a boogie, and we cut that side of this boogie and with a special device who is a stapler. This is a special material. It's a titanium material very tested in many kind of surgeries, not just in bariatric. So we know this material is not reactive material, is not causing any reaction in the body, and you can keep it forever in your body without problem. So we do this surgery with that device. At the end, when we put the staples of your stomach and we cut the stomach, we do extra suture over this line of staples to be sure you are not going to have any bleeding situation or leak. So we have a double reinforce, one with the staples, one with the stitches over your line of cut. So actually, I have not any bleeding situation in the last year at least, because we are very take a very precaution with this. And you know, the most common complication in any surgery, not just in bariatric, is a bleeding situation. So we are happy to don't have these situations, because we reinforce that line and we are very precaved to don't have any problem with this kind of complication. And well, this is the gastric sleeve. You lose the average successful rate in this surgery is you lose 80% of the excess of weight. So if you have 100, for example, 100 weight, excess of weight pounds, you will lose at least 80 pounds. So this is the 80% of 100, for example. That is the successful rate for this surgery at least, but some patients lose 100% of the excessive weight. That means all your excessive weight, it will loosen with this surgery. And if you use very well this tool, you can conserve that weight loss forever. So you can have the opportunity to get a new style of life, or new diet, and healthy diet to keep that weight loss forever, because this tool, it will works. It's impossible to don't work this tool, but at the long term, you just need to eat healthy, and that's it. Okay, so the sleeve surgery, like I say, is a low rate complication, very low, actually close to 0%, 0.5% of complication. It's a fast recovery. It can be revisited. You can get a revision at the end if something come to want to get a revision. Surgery is easier to be revisioned, and well, it's not changing your absorption. Don't change nothing. You will absorb all the food and the vitamins and the proteins normal, because you will have intact your gastric anatomy and your small bowel and everything. Okay, it's if you never had acid reflux, you won't have a big problem with this surgery. If you already have acid reflux, bad acid reflux, we could check if it's for anatomy defect, like hiatal hernia, and we can repair at the same time. But if it's for another things like incompetencia of your sphincter, we have another options like bypass, gastric bypass. Okay,